We are back here on Healthy Living. Again, we're with CEO Jeremy Clark from Hilton Head Healthcare System. Thank you so much for joining us. And Dr. Patrick Snowman, again, Hilton Head Regional Health. You know what? I should have said that, Jeremy, so I apologize for that. Yes. All right. I would like to ask you some of the common questions that you get asked, okay, during this uncertain time.
Okay.
And go ahead.
Yeah, probably the number one question I get asked is, how many patients can you take care of? If there's a surge of patients, how many patients can you take care of? How many ICU beds do you have? How many ventilators do you have? And so I would start by letting everyone know that we already today have more capacity in terms of beds and staff than we normally do at this time. We've purposely taken our patient census down to less than half of what it normally is right at this time of year. So we've created this capacity that we have already in case there is a surge of patients. So we're ready for that. The second thing is we're very fortunate that we have a lot of highly trained nurses and physicians and techs in our community, in our health system, and they're not all real busy right now. So for example, our operating room nurses have significant amount of time to be able to cross-train and to learn or relearn what it's like to be on a med-surg floor with those nurses. And so we're spending this time right now really cross-training, bringing people up to speed, and just getting ready, getting the staff ready in case there is a surge of patients.
Let me ask you a question in that line. I'm sorry, I didn't mean to interrupt. I know we listen and hear a lot about, New York is sort of the epicenter of what we hear about. And I know that when we listen to the news now, oftentimes it's like, okay, we're getting better, we're getting better, we're getting better. And I guess for us, I always feel like we're 2 to 3 weeks behind that in where we need to be as far as being vigilant. We need to still be vigilant is really the message.
Absolutely. You know, we see the same pictures. We hear the same stories that are coming out of New York and other places and other hospitals. And really our hearts go out to those patients and those caregivers, because those are some incredibly trying times. But everyone should know that's not the situation in our community today. And so we're using this time to get ready if that comes. We should also be cautioned and not get overly things are cresting or peaking or this is going away. We've got to stay vigilant. We've got to continue to maintain social distance. We've got to continue to stay at home. We've got to continue to cover your mouth, cover your face with something, all the things that we talked about a minute ago, until this truly passes. So we can't get overly confident that we've beaten this yet locally. We need to stay vigilant and continue to stay prepared.
Dr. Snowman, I have a couple questions for you. And the first one is, I'd like to know a little bit about your role, if I could ask, with the EMS Fire and Rescue and what you all are doing, again, from a community standpoint. And I'd like to segue from that into the emergency rule, the emergency department role, when we need to come, what we need to do, and really expectations that you have for our community.
Sure. Well, first, I am an emergency physician at Hilton Head Regional, and I have been there for 16 years. One of the roles that I've been involved with for nearly a decade now is the medical control responsibilities for Hilton Head Island Fire and Rescue. So I work very closely with Chief Tom Boothele, who's the chief of EMS, in developing protocols for how we care for patients in the pre-hospital setting. And of course, all of my emergency medicine colleagues at the hospital provide online medical control on a case-by-case basis from when the paramedics have questions out in the field. So what we're doing at the fire department is very similar to the hospital. I would say we're being a bit more aggressive with using PPE in a staged fashion. So every single patient that we interact with a mask is placed on them, and our paramedics wear a mask and gloves at a minimum. And that has to do with some early experience we had 3 weeks ago now with with interacting with patients that didn't seem to be high-risk patients, and then subsequently realizing that they might be. So we just go ahead and assume that there is a potential risk and treat every patient interaction that way. And the community is starting to get used to it. We tried to be proactive about communicating with the community that, hey, if we show up with a mask and PPE on, don't be alarmed. We're just trying to keep our firefighters safe. We need them on the front line. And the same thing goes with our E911 dispatchers. We're protecting them because they're a very highly trained, small group of people that we need to be 100% ready for this pandemic.
Can we talk a little bit about calling 911 and the EMS and signs and symptoms, and specifically when it would be appropriate to call? Because I think that is something we don't really know. We don't, at least I would probably err on the side of, I don't want to bother anybody. But what are some practical guidelines?
I think that's a really important question. And I think there's two basic answers. The first is that in terms of calling 911, you should have a low threshold for that. The 911 operators are there, and they're there to answer your questions. And as of about a month ago now, we have invoked new screening procedures that they use to ask you questions about signs and symptoms, both so that they can give some advice about whether or not they think you need to be seen, which is not typically something 911 operators do. It's a new role for them. They also have access to the telehealth resources through MUSC, such as MUSC.cares, and also DHAC and other online telehealth resources, which are also available through the Hilton Head regional website. So call whenever you need to.
Okay.
The fact is, the result of that call may not result in an ambulance going to your house, and most of the time that's okay. If you're very sick and short of breath and there's any concern whatsoever, they're going to dispatch an ambulance and maybe a fire truck immediately. There's not going to be any real delay in that once they know that there's a true emergency. And then I'll leave it at that for now, and we can talk about some of the things that we recommend that you absolutely do come to the hospital for later.
All right, that makes a lot of sense to me. What I hear, Jeremy, is a tremendous synergy between a lot of interdisciplinary people in the community. In other words, it sounds like everyone is working together to make this event really coordinated.
Yeah, I would agree with that. And, we're fortunate that we have such strong relationships with our local EMS providers before this came about. So that obviously, those strong relationships facilitate the cooperation and the coordination of care for the community. But I do want to hit on one other thing that relates to this. We have been blown away by the support of the community for our health system. It's really been incredible. The restaurants that are bringing food for our staff, the community members that are sewing cloth masks for our staff, the donations of N95s and gloves. It's really been incredible. And I can't say thank you enough to our community. Our staff appreciate it. Our docs appreciate it. I appreciate it. It's just been incredible to see. And I think it's so noteworthy that this is coming during a time that we're all under a lot of stress. Our entire community is under a lot of stress and tough times. And yet you have these organizations, these individuals that are stepping up to take care of our frontline heroes, our healthcare providers. So I just want to say thank you again to the community. We've been blown away by the support that everyone has given us.
And Dr. Snowman, back to you for one moment. And listening to that gratefulness and that gratitude, I think, is pretty amazing. What are some practical guidelines for us now? What are some things that we can do to stay and be safe?
Sure. Well, first, I have to echo what Jeremy just said. It is truly, I've had teared up at times going to work and seeing all of the donations and just the really kind words and support that we've gotten from the community. That is absolutely true, and it's been every single day. And we appreciate that more than you can imagine. It really does help us go in and do what we need to do. As far as general guidelines, there's nothing new here, but it does bear mentioning, I think, that, the first thing that I would tell somebody when they're asking the question, should I call 911, is yes. The second thing I would say is, should I just go to the ER if I'm not feeling well? The answer is no. Call 911 and get some advice. Go to musc.cares and do a telehealth consultation. Obviously, if you're very short of breath and you can't speak in a full sentence, or you're having severe pain, or you're bleeding, or there's something that's just unambiguously an emergency, then you're going to come to the hospital, be it by your own vehicle or by EMS. But the main things with COVID that we want you to be aware of are shortness of breath, and sometimes associated with that is altered mental status. So your loved one is not interacting with you normally, they're confused, they seem short of breath, they can't get a full sentence out. That's an emergency, because that's how people get into trouble with this virus. It's a respiratory virus, and if you can't breathe properly, you need to go to the hospital.
It's really amazing. This has been, I think, the quickest healthy living show we've ever done, because I think the more we know, the more we want to know. Very grateful, Jeremy, for you allowing us to do this. Dr. Snowman, it's always a pleasure to talk with you. We want to thank all of you, the viewers, for joining us here during this really interesting time here on Healthy Living. Have a great week. Bye-bye.
Thank you, Deb.